Good afternoon. Hello, everyone. Hello, and welcome to Down to the Roots with Miss Tanya J. And today I have a very, very special guest here, Dr. Tracy Bullard, and she is going to help me let everyone know just how important family medical history is. And this is just a big part of the Family Medical History Project. And I'm going to welcome you, Dr. Tracy Bullard. Thank you for
Thank
being here
you.
today.
Thank you,
And
Tanya, for having me. And Merry Christmas to you.
And happy holidays to you too. Um, Dr. Tracy Bullard, if you can just tell us a little bit about yourself.
Yep. So I'm a family physician here in North Carolina. I've practiced for 20 years, mainly in Robinson and surrounding counties. I am Native American, and I've taken care of a lot of underserved people, Native American and African American people from, again, the southeastern part of North Carolina. So love families. Think this is a really important topic, and really glad you're highlighting it as part of your podcast series.
Thank you. So we're going to go ahead and get started. And the first thing that I do want to ask you is if you can just tell me exactly how do you use family medical history with your patients in your practice?
Sure. So I think that's a very important question. So I feel like family history, Tanya, is one of the kind of lost art in medicine. Often if you're going to see a doctor, you may get the pre-sheet to complete. A lot of people just kind of skim over that, or even in kind of coming to the office, that information may not even be embedded into your chart. So please take time to kind of complete that, fill that out. A lot of pediatric patients, for example, may not even be living with biological parents, a mom and dad. They may be raised by an aunt or be with grandma, grandpa, so they may not even be aware of that history. So it's really important information. And part of coming to the visit with patients, we like to look, and we should be looking, not only clinical staff, but also your physician at that information and part of reviewing and also expanding upon any gaps. So I think it is really important to review. I also think it's important if your patients, again, thinking about some of those young patients, don't know those important parts of their history, that you invite other members of the family to the visit as well to help fill in the gaps.
Great.
So the role is to help for planning, and we'll talk about that a little bit more, I'm sure, but helping to plan the visit to give that big picture of patient background. So it's really important.
Great. So, can you provide me with some examples of how family medical history has had an impact on you making medical decisions, diagnosis, or to prove medical necessity of some type?
Yeah, so I think, again, I can think of important condition. One is which is sarcoidosis. Some of you may know about that. It's a condition that can be common among African Americans, and it's a condition in which there are tiny inflammatory cells called granulomas that can really embed themselves into various parts of the body, the eyes, the skin, the hearts, and they're commonly the lung. So I've had several family members through the years who may have presented with different cystin involvement. So one person may have went to their eye doctor because they're having eye issues, and it ends up being, the sarcoidosis. Another person may be presenting, and we just see it on chest x-ray. So by being able to link together your family history, you can prevent unnecessary tests, allow for quicker treatment, diagnosis, ultimately save money, and then you lessen your burden too as a patient, having spent months, maybe years, with not being diagnosed or incorrectly diagnosed.
Wow, that's wonderful information. Thank you. And so, like, have you had any instances where a person was diagnosed with a condition that could have been prevented or caught earlier had family medical history been provided, and vice versa? Any circumstances where you were able to catch a condition and treat it conservatively due to early detection?
Yeah. So again, another really good question, Tanya. So let's talk about an issue that hits real close to home for women, and that's breast cancer, right? And we know that Black women already are 2 times more likely to be diagnosed from breast cancer than white women, and they're also 30% more likely to die from cancer. And a lot of times this is, lack of lower rates of surgery, lower rates of chemotherapy, and also we have delayed findings. So not only is it really important to get your mammogram, just a reminder for all the women out there in regards to that, but again, when we think about conditions that we can catch early, so how do we use family history to kind of guide that? And if you are able to understand your family history, there are risk calculators. So, for instance, having a first degree relative, that's a mom or sister or daughter with breast cancer, having multiple family members on either side, either your mom or dad's side, puts you at higher risk if they have history of breast or ovarian cancer. So it's important to know what grandma died with. Years ago, some of that information wasn't even listed on death certificates. So it can be really important to go back and do some really digging and trying to piece together his family histories. And then one of the other risks is also for male men. You aren't excluded. You can have also breast cancer, and women need to know those risks. Women and men need to know those risks as well. So family reunions can look a little bit different, right? Instead of just saying, let's
Right.
have some mac and cheese, it's, hey, have you had your mammogram? And is there a family history that maybe you didn't know about? So it can not only save your life, but early detection for someone you love. And having these conversations and feeling comfortable with these conversations is really important.
Great. So, like, when you're looking at that family medical history of your patients, is there particular information within that family medical history that's like the most important? For example, a person has presented with family members that have had heart conditions. At some point, is there a concern, or at what level is there not a concern? If it happened like at a certain
Mm-hmm.
age, or deaths, or when do you like? What are the most important pieces out of that information once you have
Yeah.
that family medical history?
So that's really good that you point out that, heart disease, we are in the South, the stroke belt, and knowing that family history again is key. Two, it helps us risk stratify. So for a grandparent that maybe had a heart attack at 70, that may look very different if you've had a father that had a heart catheterization or a heart attack at age 40. So that means early screening, early interventions. We may do other things, not only just are you a smoker, but hey, let's get more involved. Are you exercising? Or have you had calcium scoring done of your heart looking for plaque? So family history definitely, again, allows us to risk stratify, allows us to guide, allows us to take in this information as your clinical team and, maybe do some early interventions or having earlier conversations that we wouldn't normally have with other patients.
Okay, so like for example, would you say it'll be feasible? Like generally, the insurance won't cover mammogram or colonoscopies until you're at a particular age, just 40 or 50 or whatnot. If they have that family medical history that indicates some genetics, or a high risk of that, does that make it easier for you to fight with the insurance company if they
Yep.
say it doesn't
Yep.
work? Okay.
That's
Okay, great.
perfect. That's perfect. Even in women, Tanya, for instance, if you have that first degree relative and there's a genetic marker, you can get approved for an MRI of your breast. And that's not a screening that I would be eligible for example, but that family history and having that earmarked on your chart definitely is going to allow that to be possible. And then your point on the colon cancer screening, again, normally, it used to be age 50, we've moved it down to 45, but again, if you have family history that's early, all bets are off. It should be 10 years prior to that first diagnosis. So if a dad was age 40, then that screening would move down to 30. But if you don't know your family history, you may be missing some very important screening tools that you'd be available for.
Okay, well, thank you. I do appreciate that information. Very important. And I think that people just don't know how important it is. And I'm hoping that
Right.
everyone that's listening is able to suck in this information and take heed to it so that you can be healthier in the future. And at a cost standpoint, I think it'll be very, very helpful because if you're able to, start out by going to your physician and just kind of outlining that family history, they can tell you if you start to have certain kind of symptoms when you should return to the office or when it will be important to do certain things
Right.
instead of continuously planning for office visit because now you have this symptom or you're coming back another $300 later because you have this symptom, but you have no family history to support that information. So if you want to save money, I think that that's a great way to start.
Mm-hmm.
Doing that is, having that family history as well
Mm-hmm.
and discussing symptoms if you are or are not having them. That gives the provider opportunity to prevent, so there's
Right.
more preventative than treating. Any final thoughts for you about this family medical history, Dr. Bullard?
No, I just love what you shared and being able, we know that there are still huge health care disparities in communities. Minority people in particular, we just don't get the care we need. And sometimes we don't get it as early as we need it. So being able to empower yourself through family history, being able to leverage that and your knowledge will hopefully prevent, like you said, poor health outcomes. So I love that you're sharing this. Know your
Thank
history
you.
and make your history be known.
Thank you. And while I have you on here, Dr. Bullard, as well, just want to share with everyone that having genetic testing can be very difficult and pricey. So, if you're able to at least provide this family medical history as much as you can to your provider, if you're having concerns about genetics or hereditary things, there are companies out here that are able to offer affordable genetic testing, little to no cost, and can be based on your income, as long as you have either spoke with your provider and talk to them about it, and they have certain tests that they're sponsorship tests. If you fall in any of the categories, they'll be more than happy to have your doctor sign an order or something like that, and they can do the test for you and then you can follow up with those concerns. But that'll be another segment as I talk about the different resources and ways to access your family medical history to help you out. I will also be offering some classes coming up or workshops where I would have people to sign up for those so that I can delve into those details in specific. But I do want to thank you so much for taking time out of your busy schedule to join me on Down to the Roots and talking to everyone about the importance of family medical history. Thank you.
Thank you. Have a good day.
You too.